West Africa, Ghana documentation and record-keeping standards nurse completing patient records at the end of a shift. Good documentation protects the patient, supports the next health worker's decisions, and protects you professionally. Poor documentation puts all three at risk. Principles of good documentation: accurate, timely, objective, legible, complete. Every entry should be accurate, written as close to the time of the event as possible, objective rather than judgmental, legible, and complete. What to include in a clinical entry? 1. Date and time of the entry and of the event described. 2. Relevant findings, history, examination, vital signs, investigations. 3. Your clinical impression or working diagnosis. 4. Actions taken, treatment given, referrals made, counseling provided. 5. The patient's response or outcome, where relevant. 6. Plan what happens next and who is responsible. 7. Your name, signature, and role. Every entry. Date, time, findings, action, plan, signature, correcting an error in a record. If you make an error, draw a single line through it so the original remains legible. Write the correction and initial and date it. Never use correction fluid or completely obscure the original entry. Single line through errors never obscure the original. Don't leave entries until the end of a busy shift when details are harder to recall accurately. Don't use vague language like patient fine without specifics. Don't record subjective judgments about a patient's character rather than objective clinical observations. Don't obscure or erase a documentation error rather than correcting it properly. Correct errors properly single line. A clear, accurate record is one of the most important tools you leave behind for the next person caring for your patient.